What is fibromyalgia? Fibromyalgia is a long-term, or chronic, condition. It causes symptoms such as musculoskeletal pain, or pain in the muscles and bones, tenderness, general fatigue, sleep and cognitive disturbances. This condition can be hard to understand, even for healthcare professionals. Its symptoms mimic those of other conditions, and there are no tests to definitively confirm a diagnosis. As a result, fibromyalgia is often misdiagnosed. Fibromyalgia symptoms: fatigue, trouble sleeping, non-restorative sleep, or sleeping for long periods of time without feeling rested, headaches, trouble focusing or paying attention, dry eyes, rash, itching, pain or a dull ache in the lower abdomen, bladder problems, such as interstitial cystitis, depression, anxiety. The condition can affect your emotions as well as your physical health. Discover more signs and symptoms of fibromyalgia. Fibromyalgia treatment. There's no cure for fibromyalgia at the moment. Instead, treatment focuses on reducing symptoms and improving quality of life with medications, self-care strategies, and lifestyle changes. In addition, you may wish to seek out support and guidance. This may involve joining a support group or seeing a therapist. Fibromyalgia medication. Common medications for fibromyalgia include pain relievers, anti-seizure drugs, and antidepressants. Pain relievers: acetaminophen, Tylenol, aspirin, ibuprofen, Advil, Motrin, naproxen, Aleve, naproxen. These medications can lower your pain levels, reduce discomfort, and help you better manage your condition. Natural remedies for fibromyalgia. Occupational and physical therapy, which improves your strength and reduces stress on your body. Acupuncture, massage therapy, meditation, yoga, which you should approach with caution if you have hypermobility. Tai Chi, exercise, stress reduction techniques, a balanced, nutrient-rich diet, 5-hydroxytryptophan, 5-HTP, and amino acid. Fibromyalgia causes. Healthcare professionals and researchers do not know what causes fibromyalgia. According to the latest research, the cause appears to involve a genetic disposition complemented by one or more triggers, such as infection, trauma, or stress. Experts do not fully understand trusted source what causes the chronic widespread nature of fibromyalgia pain, either. One theory is that the brain lowers the pain threshold. Sensations that were not painful before become very painful over time. Another theory is that the brain and nerves may misinterpret or overreact to normal pain signals. They become more sensitive, to the point where they cause unnecessary or exaggerated pain. This may be due to a chemical imbalance in the brain or an abnormality in the dorsal root ganglion, which is a cluster of neurons in the spine. Genes. Fibromyalgia often runs in families. If you have a family member with this condition, you are at a higher risk for developing it. Researchers think certain gene mutations may play a role. They've identified a few possible genes that affect the transmission of chemical pain signals between nerve cells. Infections. A past illness could trigger fibromyalgia or make its symptoms worse. Infections that have possible links to fibromyalgia include flu, pneumonia, Epstein-Barr virus, gastrointestinal infections, such as those caused by the bacteria Salmonella and Shigella. Trauma. People who go through severe physical or emotional trauma may develop fibromyalgia. The condition has been linked to post-traumatic stress disorder, PTSD. Stress. Like trauma, stress can have long-lasting effects on your body. Stress has been linked to hormonal changes that could contribute to fibromyalgia. Fibromyalgia tender points. In the past, a person was diagnosed with fibromyalgia if they had widespread pain and tenderness in at least 11 out of 18 specific points around their body. Healthcare professionals would check to see how many of these points were painful by pressing firmly on them. Common tender points, or trigger points, included thigh, back of the head, tops of the shoulders, upper chest, outer elbows, hips, knees. For the most part, tender points are no longer a part of the diagnostic process. Instead, healthcare professionals may diagnose fibromyalgia if you've had pain in 4 out of the 5 areas of pain as defined by the 2016 revised diagnostic criteria, and you have no other diagnosable medical condition that could explain the pain. Learn more about fibromyalgia tender points. Fibromyalgia pain. Pain is the hallmark symptom of fibromyalgia. You'll feel it in various muscles and other soft tissues around your body. The pain can range from a mild itchiness to an intense and almost unbearable discomfort. Its severity could dictate how well you cope day to day. Chest pain. When fibromyalgia pain is in your chest, it can feel similar to the pain of a heart attack. Chest pain in fibromyalgia is centered in the cartilage that connects your ribs to your breastbone. The pain may radiate to your shoulders and arms. Fibromyalgia chest pain may feel sharp, stabbing, like a burning sensation, as if you're struggling to catch your breath, which is also a symptom of a heart attack. Back pain. Your back is one of the most common places you'll feel pain. Most people have low back pain at some point in their lives. If your back hurts, it may not be clear whether fibromyalgia is to blame or if it's another condition such as arthritis or a pulled muscle. Other symptoms such as brain fog and fatigue can point to fibromyalgia as the cause. It's also possible to have a combination of fibromyalgia and arthritis. The same medications you take to relieve your other fibromyalgia symptoms can help with back pain, too. Stretching and strengthening exercises can help support the muscles and other soft tissues of your back. Leg pain. You may feel fibromyalgia pain in the muscles and soft tissues of your legs. Leg pain caused by fibromyalgia can feel similar to the stiffness of arthritis or the soreness of a pulled muscle. The pain can be described as deep, burning, or throbbing. Sometimes fibromyalgia in the legs feels like numbness or tingling. You may have a creepy crawly sensation. An uncontrollable urge to move your legs is a sign of restless legs syndrome, which can overlap with fibromyalgia. Fatigue sometimes manifests in the legs too. Your limbs can feel heavy, as if they're held down by weights. Fibromyalgia risk factors. Available research still has not identified an exact cause of fibromyalgia. Factors that may increase your risk of developing it include sex. Most fibromyalgia cases are currently diagnosed in females, but the reason for this disparity is not clear. Age. You're most likely to be diagnosed in middle age, and your risk increases as you get older. Children can develop fibromyalgia too. Family history. If you have close family members with fibromyalgia, you may be at greater risk for developing it. A history of other conditions. Although fibromyalgia is not a form of arthritis, having rheumatoid arthritis, RA, may increase your risk of also having fibromyalgia. Fibromyalgia also affects around 30% of people with lupus. Research continues to evolve to better understand this condition and its origin. Fibromyalgia diagnosis.